Hi, welcome. Thank you, Dr. Ashitey, for joining us today. We really appreciate it. She is a doctor at Southwest Family Medical Center, correct?
Family Medicine Associates.
Associates. I knew there was something different about that.
I know. Don't worry. I sometimes stumble upon the words as well.
Exactly. And she's here to talk to us a little bit about HRT, or hormone replacement therapy. So thank you very much for stopping by and having this conversation with us.
The pleasure is mine. Thank you for having me.
So I'll let Christine start.
Sure. So when I started my hormone replacement therapy, I jumped in headfirst, knew absolutely nothing about it, other than that I just wanted to take something to alleviate my gender dysphoria. So what advice would you have for transgender individuals, whether they're male to female or female to male, as to what research do you feel that they really should or ought to do prior to starting their medical transition?
Yeah, that's very important. Information is everything. You want to understand what your personal goals are. So when patients come to me for transitioning, I first ask, one, how they would want me to refer to them. You want to know that so that you can let people know. But aside from that, what are your goals of care? How far are you wanting to go? How fast are you wanting to go? And how slow are you wanting to go? Because there isn't a one size fits all. Sometimes when I ask that question, patients are surprised, like, what do you mean? Everybody desires this. And I say, no, it really does differ for everyone. But you also want to know and do your research about, providers out there. There's a lot of discrimination. And unfortunately, trans health is not integrated very well into our medical training. I'm really hopeful that, over the next few years, it should get better. But you want to get someone who is comfortable with taking care of you. There's a lot of discrimination out in the world, and when you choose a doctor, you're sharing some at times things you haven't even shared with your family yet. So you want to find someone whose office is supportive and who has experience. But then you want to know what options are out there for you. What types of treatment are there? Is it injectables? Why or why not? Why would it be good for you? Why would it not be good for you? You want to ask as many questions. What are the risks versus benefits? And there's a lot of information on the internet, but definitely having a family home where you can have open conversations with your physician is very key.
Now, do you feel that it's very important? You made the comment about they may be having this conversation before anybody in their home or their family may even know about it. Do you ever, is there ever a conversation about, hey, you really need to find some support within the family before doing this too? Or do you just go forward?
Oh, family support is everything. In fact, there's research to back it. When I think I can give you a look. For me, the biggest thing that drove me to say is I like to take care of people, and the data is quite strong when you look at the suicide rates in trans adolescents compared to cis adolescents. It's crazy. It's quite strong. It's the difference. I mean, in cis adolescents is 16% compared to 50% difference. But then when you have family support present, the success rates are amazing. There's less dysphoria, less depression and anxiety, less homelessness. And so support is everything, and there's great data to back that.
Well, and I think a lot of, or at least a lot of the stories we've heard, is that people are trying to figure this out on their own and then bringing in their family at a later time. And the family's behind because they haven't had time to catch up. So, are there good sites or good information for family members anywhere to also kind of get some of that information? Or I know we also know about the 3 different ways that we've become
Mhm.
aware of. Is there
Mhm.
more than that, if you could speak to both of those things?
Sure. So I think what you're referring to is WPATH, or the World Professional Association for Transgender Health, and then there's the Endocrine Society, and then more recently there is the Powers Method by a physician, I believe in Michigan,
Mhm.
Dr. Powers, who is quite revolutionary and has a lot of exciting results. I think WPATH is considered the standard of care, developed sometime in the 70s or so. And I believe the Endocrine Society actually adopts a lot of its practices from that. If you go to UCSF, that is, I believe, University of California, San Francisco, they actually have a comprehensive sort of, what do you call it, summary of WPATH and Endocrine Society, and pretty much all the questions that you can imagine are on there. You know, what to do as far as general health, what are the different medication options, what are other considerations when it comes to surgery. So that's a great resource, I think, for a
Mhm.
good, concise, although I would say exhaustive document if you're looking for a lot of information. There's also Dr. Power's website, you know, and he has a lot of information there that you
Right.
can look up and read and learn. But I always encourage people that as you get these information, some of these are very technical, and that is where your doctor comes in handy to help you understand and break it down. And that's why having a doctor that you have a great relationship with matters, because you're able to sit and talk and say, hey, I read this and I've heard this here. And they're able to say, well, I don't know about that, but this here, this is what this means, and are willing to explore all that information for you. Aside from that, there are a lot of support groups. Hopefully there'll be more with time that you can find, you know, online. I believe like what you're developing, to find people who are going through the same thing that you are. You know, I can give information from a clinician perspective. I can share what, you know, patients share with me and what our experience is, but nobody can tell you what it's going to be like besides someone who's really been in your shoes, you know. And so finding those communities becomes very important, because someone who has been through it is able to walk you through it, even sometimes more than better than, you know, I could.
Right.
Right.
Well, I think support. I think a lot of people have feel like the clinician and support are 2 separate things, when I really think that they're together. And I think even when somebody is starting to transition, they feel like that they need to do this alone.
Mm.
Well, yeah, I mean, that I think has more though to do with older transgender people though.
You do? Okay.
So, yeah, I mean, if you're a younger person, you know, or a child wanting to transition, it's a little bit different, as I'm sure Dr. Ashitey, as you could probably attest to. So,
Right.
you know, when you're in your older years, it's the fact that you've kept it hidden from everyone for so many years, as well as yourself, that makes it different.
Makes it different. Okay.
So, you know, and that in itself makes it more difficult, because you've not only got to come out to yourself, but you've also got to come out to everybody else. And it's not something at that point you're used to doing, because you're too
Hmm.
used to being in the closet.
Gotcha.
So, and you think that you're in the mindset, I should say, that you believe that none of this affects anyone else but you. It's just a personal journey. And why does anybody else have to be in my business? Because this is just about me, right? But it really is not that way.
Yeah.
So obviously you are on HRT right now. Do you have any questions or additional?
Well, just as with any medical procedure, there are risks involved. So what are the general risks that you can tell our audience that are involved with hormone replacement therapy?
Sure. There are some risks, though I do want to clarify that they're typically quite low, and we monitor very closely for them. But some of the risks associated with hormone replacement therapy include blood clots, a heart attack or a stroke is possible, liver enzyme abnormalities are possible as well. A lot of these at times have to do with a person's family history or personal medical history as well. It's not clear whether or not, the female hormone type cancers or sensitive cancers are increased or not, but there's a potential. And so we always advise trans women that, self breast exams, monitoring for breast cancer, as we would for cis women, is
Right.
very important and key because it's not clear whether or not that increases the risk. With that said, a lot of times when I talk about risk with patients, some people kind of get scared that that might be a cause for no longer being on hormone therapy. And I want to assure people that they're very, very like rare instances
Right.
that it would be contraindicated. There's always something that we can do to ensure that you're able to continue, or almost always something we can do to ensure that you're able to continue with your transition. It's important to always be open about symptoms that you're having so we can figure out how to continue you on your therapy safely.
Right. And I'm, of course, a good example of that. So I ended up overdosing on my estradiol and I had a blood clot. It was very small, but nevertheless, I am on blood thinners. So that way I can continue my therapy. So
Right.
here's an example right there of where, if you had issues, there's almost
solution.
always, as you said, a solution or something
Right.
to do.
Well, just like anything else, it goes back down to your physician and your medical community that you work with as well, making sure.
Yeah.
So what are some of the things that when somebody is thinking about transitioning that they should ask or interview a doctor for? Because I know there's a lot of people who say they're trans friendly and that but they may not really understand the transgender
Sure.
and stuff. So how do people find the best that they can find? Like what are some things they can look for?
Well, I'll be honest, one of the things that I've realized is my patients talk to each other. So look around you, in your own trans community and their experience. Because people will tell you, even when you're looking for a doctor, I mean, when I'm looking for a doctor,
Mm.
I don't look to what the magazines say about the doctor. I look at what other patients say about the doctor.
Yeah,
You know,
absolutely.
yeah, I mean, I'm a doctor and that's what I do. I don't just go to my colleagues, who's got the best such and such. No, I'm looking at what other patients, what has been their experience, who will listen, who's willing to work with you. Those are some things that you want to find out. Are they traditionalist in that they just follow one path, or are they willing to branch out and try different things? And you may decide to go one way or another just based on your preference, and it's okay. But those are the kinds of things you want to find out. But really, just looking next to you at people just like you and what their experiences have been. That person to person referral base makes a difference because then you're getting to hear about the experiences on a different level, so to
Sure.
speak.
Absolutely. Now, when you mentioned about hormone replacement therapy, you said that it's turning into a very individualized science. So, I mean, in the beginning, as you know, with WPATH and Endocrine Society standards, they seem to have this blueprint that they
Mhm,
thought might be, one size fits all, that
mhm.
everyone's supposed to stick to this blueprint and do exactly as it says with no changes, no additions,
Right.
we say so, right? So, but we're finding out nowadays, would you agree that hormone replacement therapy really is more of an individualized science?
Oh, 100%. Yes. I, when I counsel my patients, I say, really, you're the driver, you know, and you're the one who knows where you want to go. And I'm the mechanic, I come in and I say, hey, you're driving too fast because this little pipe here is doing this, you
Right,
know.
right,
I see you want to get to Canada, and my goal is to get you to Canada, but these are the things we need to fix in order to get you to Canada. You want to
right,
stop over in New York and hang out there for a little bit for this and this and that. This is how we can get you there. And so you're right, it's individualized. I have a patient who just wants to feel a little bit masculine, and a little bit feminine, you know? And so with that goal, how do I determine where that endpoint is? My
right.
patient is the one who knows what that endpoint is. And so self-exploration for my patient is very important, right?
Mhm.
To know, but then as a clinician, I have to be respectful of that, to work with my patient as long as there is no harm. And that
Right,
is what my duty is to my patient, and my obligation is to, above all, do no harm. And so the clinician's role is to prescribe and help the patient get to their goal. Remember, we're battling against dysphoria. And so my patient tells me where they are going, and I use the medication and reviewing of labs to make sure that we're safely getting there.
right. So, one of the things that I've experienced myself with some transgender friends of mine who started much longer ago, because of course the science has come a very long way and is still, growing in very many ways. But one of my friends actually, her story kind of disheartened me because she was seeing a doctor, and I think is still seeing the same doctor, who basically told her that we're going to follow this WPATH standard, and by the way, you're probably not going to develop a very good figure, so you're going to just end up getting probably breast implants, or in the community it's known as top surgery, and that's going to
Mhm,
be it, right?
mhm.
So that kind of thing, it just seems very disheartening to me.
Well, I think that goes back to having a good doctor
Right,
who is staying up on things as well.
Yeah, and I think specifically what you're referring to is the Powers method. Dr. Powers has studied, transitioning, the transition for cis, adolescents through puberty, and at what point do certain hormones become more implicated in breast development, and he's
right,
been
right.
using progesterone to develop, and it's quite impressive. um, so again, you want to see what your doctor's willing to do
Right.
um, for you. And I think the key is keeping you safe. And as long as the data
Mhm.
shows that there's no harm, you should be able to proceed.
Right. And that's part of what you talked about with the educational component of it. And that's why I, of course, now feel that educating yourself is so very important for this, because you really need to at least know what you're getting into and
Right,
how things are, what is out there, basically.
right.
Because mentioned Dr. Powers. There's also a very good Reddit out there page that has Dr. Powers information on it as well. but there's also a very big community, it seems, out there of transgender people who are DIY or do-it-yourself selfers. And I think a lot of the reasoning for that is because, until like things like Dr. Powers it came along with his method, nobody was really interested in doing any kind of research on
Right.
transgender medicine. So there ended up being a lot of experimentation in, so to say, the dark web and things like that. But, that is, could be a very dangerous thing to do. I mean, wouldn't you
Right.
agree?
I agree. Anytime you're injecting any bioidentical hormones or even taking any medication, um, without supervision, without knowledge of what's going on inside your body, you increase your risk. And that's why there's such a need for, one, more research, two, more training for clinicians so that we can safely help people transition.
Mhm.
But I would highly advise that. I mean, at this point in time, there are clinicians that you can find that can help take care of you, and you just have to do the research, and find them, seek them out, talk to your friends, so that you can be taken care of safely.
Right.
What do you think about the over-the-counter supplements?
Well, yeah, I mean, I was
That's
going to
fine.
get into that
Okay.
too. One of the things that I experimented with, which I kind of regret playing around with, were phytoestrogens prior
Mm,
to even starting hormone replacement therapy, because I kind of got lured into the internet myth of, that these things were going to help me, that they were going to possibly help feminize me and take care of my gender dysphoria. But instead, I found out, well, at least personally for me, they ended up causing more health problems for me,
mhm,
because I was first experimenting with things like black cohosh, which is typically a root that is used for alleviating postmenopausal symptoms in women. It's supposed to be a estrogen booster, and other things like that, like Puria mirifica, which actually is a very, very powerful phytoestrogen too, by the way.
mhm.
So, what would you say to people who are, experimenting with things like that?
Simple, don't.
Right.
um, I wouldn't encourage it. What is your endpoint? How are you titrating? What are you using to reach your goal? And what are the other things that you're not catching that you're doing to yourself, in the long term? It's very important, again, to seek professional help. It is out there, to safely help you meet your goals.
Right. So I agree. I mean, the one thing that it did for me that I didn't even notice actually at the time was it increased my anxiety,
Hmm.
because it was causing inflammation and other issues within my body that, I wasn't really seeing, and I didn't see any changes either. So
Mm,
like these phytoestrogens for the most part will cause, I'll say, mental changes, but won't cause any physical changes to your body, which is really what you desire. So
right.
for me, they ended up causing more gender dysphoria because, you're taking these things expecting something to change and nothing's changing.
Mm-hmm.
So it causes more frustration and anxiety.
Right. And
And
so
help.
and that's why we're so glad that you joined us today so that we could get real good information out to um, other transgenders and families so that they understand this. Because I think, as you said, there's a lot of information out there and it can be overwhelming. And in some cases, you don't know who to trust
Right.
on that.
Right.
So, but I think we were blessed to find some great doctors that we work with that have been taking care of us, and I hope that others will do that as well. Is there any last few questions or anything that you wanted to?
Well, it'd be kind of more of just an open question to Dr. Ashitey, really. I mean, what other advice would you give to someone who is considering hormone replacement therapy?
Um, so one of the things that I talked to, and actually I've been surprised that a couple of people have not given too much thought, is whether or not you desire to have your own children. So this is for my patients who are transitioning at a younger age. It's not yet known whether or not this fully affects fertility. And so the assumption that we should make is that it does. And so if there's a desire for, future children, making plans to, sperm bank or whatever, have a conversation with your clinician, because there's a way that you can meet your goal and transition as well. It's almost never one way or versus the other. I also want to talk about, you mentioned, your friend being told that your only way was breast surgery, and that was it. Surgery is actually very risky.
Right.
Anytime you have to be put under, it's a big deal, and so if something can be managed, if you can meet similar results with an oral medication that can be monitored and reversed if need be, that should be the first option,
Right.
or the first choice. Of course, depending on what your goals are. And so take those things into consideration. Do I want to have, because depending on what your goals are, the surgeries that you may have may not just be one, you might have a couple. So do you want several surgeries or do you want less, and how can you meet those goals without having to go under the knife so many different times?
Right.
So also I would say, I tell this to all of my patients, you are the guardian of your own health. Never feel intimidated by any clinician. You should be able and feel comfortable asking questions. And so go in prepared with all of your questions and don't apologize for having them.
Right.
Because
that was my thing. She had all the questions.
I had a whole list for
none.
Yeah.
She was like, let's just go. And I'm like, wait.
Yeah. Don't apologize for having them, because, this is your life with everything, actually. When someone prescribes, says, hey, I'm going to give you this medication, or hey, we're going to do this surgery, you want to ask, what are my other options? Do I have to do this? Why this versus that? And it's okay. You may feel like you're taking their time. You might have to come back another time. The truth is that as clinicians, the way medicine is carved out these days, truth is we only have a few minutes with the patient, and I hate it. That's why I'm always running behind because I like to take my time and educate my patients, and the amount of time that we have is ungodly, a terrible small amount. And so sometimes it might mean that you have to come in, or schedule another visit, and it's okay, but don't apologize for having your questions. In fact, do go in with questions because you need to be educated. And if you're my patient, I'll make sure you are, because I quiz. I'll give you a handful and then I'll ask you to teach me back. But it's because you need to know, you're the guardian of your life. So.
Right. I think one thing that I heard out of this that we didn't really have in place when you started was knowing what your goals were.
Right.
I think that just, at the time, we were trying to figure out what those were, but you really need to have a plan of what you want.
Right.
At least a general roadmap. Then, I want to be feminine tomorrow.
Right.
Well, that's
Which
not really.
That was my plan. So I want to be there tomorrow. So
not realistic, though. I'm sorry.
About it, what we're inducing is puberty, right? It's a second puberty that we're inducing, and puberty didn't happen overnight,
No.
Yeah.
Well, and actually that brings up where you're inducing puberty, are people to expect that same whole thing again in a regards? Like, will they feel tired, sleeping like a teenager, or the moodiness and all those things as well?
There are definitely going to be some mood changes. In fact, I recently had a trans man say to me, I noticed that I can't cry or I don't cry. And it wasn't something that was distressing for them. It was a new discovery that they made, that it turns out that my emotions are different, you know?
Right.
Sometimes, depending on the fluctuations of the hormones, you know, we might have some irritability that peaks up and then goes down, and a lot of it can, you know, follow the timing of when your medication is administered. And so, yeah, in some ways, you'll see some puberty symptoms resurface. Now, the difference, though, is that especially if you're transitioning when you're older, your prefrontal cortex is much more developed. And so even though you may have these emotions that come and go, you do have a prefrontal cortex that is more mature and handles it better than, say, a 15-year-old or a 13-year-old would. So
Right.
there are some differences there.
Okay, so
That's good
even
to know.
age of that will change those types of things as well.
Yeah. Yeah.
Good to know.
Yep.
Good to know.
Well,
Yeah, it's just some of those questions we ask ourselves, like, well, is this because it's this, or is it this? And trying to figure out what situation.
Well, and remember that sometimes too, with that, you know, with the way that we handle the emotions as they change, they may come off as personality changes, you know. And so it's important to, you know, be aware, have conversations, one with yourself, the person transitioning with yourself. I'm handling this differently. What does this mean? You know, and the family member, yeah, open dialogue is very, very important, you know, to, hey, I've noticed that you do this differently, you know, in so many ways where you're still the same person, but how you process may be a little bit different.
Right.
Because, yeah.
Right. I have just one more question for you,
Yeah.
and that has to do with medical transition for younger transgender people. So I know that's kind of a hot topic, so to say, especially with parents of transgender children, is they're never sure, you know, what is the right age to even be starting to talk about medical transition for a child. You know, because I've seen the argument go both ways, you know, that, you know, this is their body. They really need to, you know, be able to make the choice. But then there's people say, well, like you kind of mentioned, you know, your prefrontal cortex is not quite as
right. Are they old enough to make
that
right,
kind of
make that decision?
Right.
I think that debate is always going to be out there. And so
Sure.
I'll humbly say what I'm presenting is in some ways partly my opinion as well.
Sure.
And I think there are a lot of opinions when it comes to this. But there are options. So one, the conversation there's never like the right time to begin having the conversation. If your 3-year-old comes to you and is having that conversation, have it, you know, don't say, hey, I'm not going to listen. You should talk about it, you know, and not dismiss. So that's important. As far as transitioning, remember, some of the changes are permanent. When you look at some of the research, especially when you look at males who think they may not have or may not be identifying as the right gender, sometimes as they get older, they realize that they're actually gay and
Right.
not necessarily wanting to be female, you know? Right. So if you transition them too early, you might have missed an opportunity for them to process and get to learn and figure out what they really want. But there are options. We can pause puberty. That option is there. You know, there are medications that we can use to pause puberty. And so, you know, that option is there to have that discussion with the clinician, their pediatrician, or their endocrinologist, if they decide to refer at that age, to at least pause puberty while they're
Right.
trying to figure out what route they want to go.
Right. So you're basically talking about gender identity versus sexual identity, which are
Right.
very distinct things.
Right, right. Yeah, exactly. And so, again, someone whose brain is not fully developed or who hasn't had a chance to live out life and really know themselves very well might not have all the answers. And sometimes they may, you
Right.
know. I
Right.
don't think it's one size fits all, but we always have to.
To be 18 to vote or
No,
choose what identity you want, you know?
no, no, it's not a one size fits all for sure. And so, um, the conversation must be had.
I was gonna say, and again, it probably goes back to even what she was talking about of having the conversation with your clinician, your counselors, and because it's not just the medical, it's the mental health as well in this.
Right,
And
right,
we want to encourage everybody to have multiple support systems, both
mhm,
medically, mentally, and personal,
right,
family, and as much support as you can.
Right.
right. And like I said, for me, the most important thing is this life or death issue, right? And I choose life,
Right.
and I choose life for my patients. And so have the conversation. Um, Sometimes it's not easy, but we're here to support you.
Yeah, and I think that's so wonderful. Thank you so much. I can definitely say, that really warms my heart. So thank you.
Absolutely.
All right. Well, we thank you very much for joining us today. And we'll put your information on the page here for if
Sure.
anybody wants to reach out to you for any other questions. And again, just thank you for participating.
Yep,
Thank
thank
you for having me. It's been a pleasure.